Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through February 16th, 2023. This week I'm going to ask the immortal question, what does public health have to do with the price of eggs? Now, it's no surprise to anyone, the issues around the price of eggs have been widely discussed. Providing a lot of humor for folks and some jokes and memes and all of those good things. But there's actually a very serious and potentially threatening public health issue around the price of eggs. If those of you who regularly follow the egg market news report from the USDA will know that over the course of the last year, the price of eggs went up hugely. Now, while it's been coming down, as shown in the red line, it's still almost double the 3-year average. And if you look back at the last 30 years or so, you can see there have been periodic blips, but nothing like what we saw at the end of last year. Now, eggs are not the only thing that's gone up in price. Many other food items have, but nothing quite as much as eggs. Now, historically, public health has been interested in eggs for two reasons. One, for a while, we were told not to eat eggs because of the cholesterol implications. But as reported recently, two recent studies have suggested that eggs do not raise the risk of heart disease in otherwise healthy people. Obviously, if you have a health issue to which you've been advised not to eat eggs, please don't do that. The other issue was the risk of salmonella, the fact that the outside of eggs could be contaminated, even the inside. And fortunately, as you can see in that second paragraph, well, the first paragraph, it's important to see that it's not a problem for commercial eggs. And a lot fewer egg-laying hens have this problem than during the 80s and 90s. So neither of our traditional reasons for being concerned about eggs is the purpose of our discussion today. So why is public health interested in eggs today, and why are the prices so high? Well, the price has something to do with overall inflation and supply chain problems. It has to do with consumer eating patterns and high demand for eggs and egg-related items towards the end of the year. Increased cost of feed for chickens, increased cost of fuel for transportation. Some have suggested an element of profit, but overwhelmingly the real reason is highly pathogenic avian influenza, so-called bird flu. A few basics about bird flu. You'll hear it described as H5N1. It's a virus that is extremely communicative among wild birds and poultry in many parts of the world. It was first identified just about a year ago in the United States, but it can kill the vast majority of infected domestic fowl in 48 hours. It's hugely fatal. So in an effort to control a flock, control its spread, once it's found in a flock, they call the remaining members of that flock, and to date, over 58 million domesticated fowl, mostly chickens, have died because of this. There have been outbreaks in 47 states, and infected wild birds have been found in all 50 states. And again, if you look at this map, we always drawn to the west because the counties are much bigger there. But actually, you can see that it's pretty much everywhere in the country. And there has been one human case in the United States about 10 months ago. Now, it can infect wild birds, but what's interesting is not all wild birds show any symptoms. So some raptors and others can get very sick, whereas others can carry the virus. And so then they're flying overhead. They land in a barnyard. Somehow their feces get exposed to the animals that are there. Now, it has been found in mammals, largely from those that have presumably consumed flesh from infected birds, including 17 non-bird species in 20 states, largely in the north. But if you look at the range of animals, big cats, bobcats, brown bear, black bear, dolphins, seals, and so on, it's widely diverse. And so it tells you that, at least from consuming meat, can happen in a lot of species. But probably the biggest news that's come out lately was that there appears to have been mammal-to-mammal spread among farmed minks in Spain. And this is the first time that mammal to mammal spread. Now, this is saying you can get exposed, humans can be exposed from chickens, for example, but it's relatively rare. Animals can obviously be exposed from eating infected flesh, but it's relatively rare. But it's not going to propagate itself in a species until it can spread from mammal to mammal. And that's why this report from Spain is so concerning to people. The World Health Organization reports that there will always be sporadic cases in humans. But what's worrisome is that among the cases that have been identified, a little less than 1,000 cases, the mortality rate was almost 50%. Now, that probably overestimates the lethality of avian flu in humans, because obviously the cases you're most likely to find are the ones that are most serious. But that's pretty worrisome. And according to the CDC, we cannot predict when the next influenza pandemic will occur. There is some suggestion that the 1918 so-called Spanish flu may have been an avian influenza virus. There is evidence that the 57 pandemic and the 68 pandemic both may have resulted from combining genetic material from both human and pathogenic avian influenza. And so why are we interested in eggs today? Well, obviously H1N1 is spreading widely among wild and domesticated birds in the United States. In addition to sporadic cases in predatory animals, there appears to be mammal-to-mammal spread, which is very concerning. And previous avian flu viruses have combined with human flu viruses to become more dangerous for people. And importantly, the longer and more widespread any virus circulating is, the more likely it will mutate. We certainly saw that with COVID, right? So the CDC says it's very unlikely, but it's at least possible that the current virus could combine genetic material with the human virus, resulting in human-to-human transmission. It hasn't happened yet. It probably won't happen, but it's important. For those of us of a certain age will remember that prior to COVID, a H5N1 pandemic, a bird flu pandemic in humans, was one of the things we really worried about. We were actually preparing for that. Right before COVID came along, I think it was a good money was probably the pandemic virus that would get widely spread in humans would either be a swine flu or a bird flu virus that mutated. So public health is concerned with the price of eggs, and it reminds us that the price of eggs is just the tip of the iceberg. Right behind it is a potentially lethal pandemic, outbreak among animals and birds that we need to watch. There's not a pandemic in people. There's not even human-to-human transmission yet that we know of, but it's worth paying attention to. As always, please share this video with anyone else who might be interested. Thanks, as always, to Derry Young for editing, producing, adding captions, and posting this video. And please, if you have any questions, thoughts, suggestions, please let me know. I look forward to hearing from you. So until next week, please be well.